Training within geriatrics in the North East gives you experience of a wide range of subspecialities, as well as really good experience of general geriatrics and general internal medicine.
I chose to live and train as a junior doctor in the North East because this is an area where there's a huge amount of research into elderly care, particularly looking at what it means to age well. And the programme up here is truly unique. You get 8 months in total spread across the 2 years where you can invest in these areas, and that will really allow me to further my interest in geriatrics.
I think the main reason I did it was because I really like the challenge. Our patients are invariably really complex, they have a lot of health problems. Quite often in medicine, protocols and guidelines are used, but they often don't really cut it in our line of work because the patients are simply so complex. So I really enjoy the challenge of balancing that and looking after them.
You can benefit their home lives, you can help their family out. And every day you're challenged by something new with these patients.
I really like working as a true generalist, and geriatrics is the speciality that gives you the opportunity to maintain your skills as a generalist more than any other.
I'm really passionate about elderly care medicine, and I think it's really important that everyone of my age kind of takes an interest in this area. Actually training it as a specialty makes you a really well-rounded physician. You have to think about the social, the psychological, the spiritual components of good health, as well as the physical side of things.
When you're the medical registrar on call, you do get the opportunity to treat the sickest patients within the hospital. You work as part of a team.
You're actually incredibly well supported, and everyone would always take your phone call and offer you advice because they appreciate what a hard job you are doing. And it's also the shifts that you're going to learn the most on.
You walk out the hospital at the end of the night, you may feel tired, but you feel like you made a difference.
You enter a training environment where you're really put first as a junior doctor. Everyone puts a good emphasis on training you, improving your skills. And so I was quite happy to carry on through from SHO into registrar training here in the North East because I know I'm going to get a good quality education from it.
There's plenty going on here, loads to do, loads to see. I felt so warmly welcomed, and people here are just so friendly. In my spare time, I like to go out and walk and travel and see some countryside, and the hills and mountains up here in Northumbria are just beautiful. It's an amazing thing to do on your day off.
The North East's a great place to live. Newcastle's a vibrant city with lots of attractions. The area's steeped in history with historic sites.
So some people don't seem to think that geriatrics is a very exciting specialty, but for me it is one of the most exciting because as well as a clinical practitioner, you need to think about quality improvement and health systems and how we can change the health system so that it suits our ageing population better.
When you're working those long days and those long hours, when you see these patients, you appreciate that they are patients who genuinely need our help, and that's something that will keep me motivated throughout my career.
It's a fab specialty. It's the place to be, I think, for the future of the NHS.